Hi viewers, welcome back. In today's video, we are going to see intrauterine fetal death or IUD. Okay. So, intrauterine fetal death, the definition for intrauterine fetal death, it is the death of the fetus after the period of viability. That is, after 20 weeks, you consider it is IUD, and before that you term it as abortion. So, now we will see what are the causes for intrauterine fetal death. Actually, you have lot of causes. Other specifically you can tell something which is related with the uteroplacental blood flow. Okay. So, when there is some conditions of the mother which is related with the intrauterine blood flow, then there will be an IUD. Okay. So, either the mother may have diabetes or pregnancy induced hypertension, sometimes it is anemia, sometimes it is malnourishment of the mother, sometimes it is smoking of the mother, like excessive smoking, like any conditions which is going to hamper the blood flow of the fetus, then it will cause intrauterine fetal death. Sometimes fetal causes, sometimes when the fetus is having severe congenital anomaly, sometimes whether the fetus is having a true knot, sometimes fetal causes can also include when we do an internal version or an external version. At that time, sometimes there is a knot, true knots, that is like knot over the neck of the fetus, and sometimes it is because of the congenital anomalies that is present, a major congenital anomaly. So, anything which is related with the fetus, all these are the causes with the intrauterine fetal death. So, either it can be a maternal cause or otherwise a fetal cause. Then we have the pathology. Okay. So, what happens after the death of the fetus? Okay. So, now there is some cause, maybe there is like the maternal causes are contributing more and the death has taken place. So, intrauterine death has already taken place. So, now what is happening after the death of the fetus? So, you can see this flow chart. Okay. So, first is autolysis. So, after the death of the baby, you know the baby is inside the protective sterile fluid of your amniotic sac. Okay. So, now after the death of the fetus, what happens? It is like inside the amniotic sac, it is becoming autolyzed. It is because of that sterile fluid, it becomes autolyzed. Okay. And then it becomes swollen and dusky red. The fetus, after the death of after the autolysis process, what happens? The fetal will become swollen, it becomes dusky red. It is because of that, it is like in the next phase it is going to get infected. So, for that it is becoming red in color, and then it becomes liquefaction of the brain matter and the other visceral layers take place. So, it is a liquefaction in the sense because like there is no adequate blood flow, the fetus is already dead. So, what is happening? It is like the collapsing of the organs are taking place. So, what happens? The liquefaction. So, brain matter becomes liquefied, it becomes the solid particles becomes liquefied, so that like it becomes collapsed and it will be delivered. Okay. So, the like the delivery of the dead fetus becomes little more easy. For that, there will be reliquefaction of the brain matters and the other visceral organ. Then comes the softening of the ligaments and the vertebral columns. So, what happens? The ligaments, bones and the vertebral columns, it becomes soft. That is what I said, no, it has to be reduced, the fetus has to be reduced, so that it is coming out easily, because now you consider the normal labor. In normal labor, there is a live fetus, and because of that the uterus is functioning and it is trying to push the baby out, but now the fetus is already dead. So, now what happens? Like the body is doing some actions to send the baby out. So, that includes the softening of the ligaments and the vertebral column. The vertebral column, the stiff column, what happens? It curves and bends, and what happens? It collapses. Okay. So, it bends and twists and becomes collapsed. And then comes the gas bubble formation. Gas bubble formation is the wherever you are seeing a liquefied material. Okay. Maybe it is in the blood vessels. So, usually in the heart chambers, aorta, greater vessels, abdominal blood vessels, abdominal walls, like wherever you are able to see liquefied material, then all these areas you are having gas bubble formation. It is because of the gas bubble formation you can see lot of changes. The baby is becoming swollen. All the pathology of the intrauterine fetal death. So, what is happening? First, the autolysis process begins, where the fetus becomes macerated, it becomes like collapsed and macerated, and then the swollen and dusky red, it becomes swollen, and then liquefaction of the brain matter and the visceral layers, then the softening of the ligaments and the vertebral column, and finally we have gas bubble formation. So, these are the changes that is happening after the death of the baby inside the uterus. So, then coming to the signs and symptoms. Okay. So, symptoms. So, you know, symptoms are something which the mother is going to report you. What the mother reports, okay. When the mother is coming to the hospital, what she will report. If you suspect an intrauterine death, most probably she will report only one thing, like I am not able to perceive the movement of my child. Okay. So, I can't feel the baby is moving. Okay. So, there will not be fetal movement felt by the mother, and there will be like receding, or like the breast changes will come down, the height of the uterus is coming down, where she is not able to feel that liveliness of the fetus. So, all these things will be the complaints of the mother. And then coming to the signs. Signs are something like what we are going to identify after the mother complains. So, what we will be able to identify when you do an uterine palpation, you can see the uterus height is less than the gestational week. If the gestational week is 32 weeks, okay, so the height of the uterus has to be 32, but now what will happen? It will be less, it will be around 26, 28. As the fetal death has taken place, what happens? The height of the uterus comes down, and you will not be able to see any visible fetal movements, you will not be able to hear any fetal heart sounds, and like you will see to that the breast changes, that softening of the breast has taken place, and like all the regression signs of like pregnancy is like coming down. As we have seen, the uterine height is coming down. You can also see the amniotic fluid level, that is the liquor level is coming down. The amniotic fluid level is also less. So, there is no fetal heart sound, and like once you start palpating, if it is like after 1 week, that is after the death of the fetus, like 1 week after the death of the fetus, then once you start palpating, you will be able to hear the egg crackling sound. Okay, that is like when you palpate the skull of the fetus, and what happened? It is because of your external compression, you can feel that egg crackling, that is like when the egg is broken down, you can feel that sound, no? The same type of sound you will be able to hear once you start palpating the abdomen of the mother. Okay. So, these are all the signs when you are going to observe when the mother is coming inside the hospital. These are the signs you are going to identify when the mother is entering the hospital with an intrauterine fetal death. Okay. So, now the next part is the investigation part. Okay. So, investigation, what all investigations you will be doing is, the first preliminary thing when you suspect an IUD is an X-ray. Okay. So, you can take a plain X-ray where you will be able to rule out many signs in that. Okay. So, first sign is the curling sign. So, curling sign is nothing but the hyperflexion of the vertebral column. So, already I have said, like during the pathology I said, like when the baby is like after death, what happens? The softening of the ligaments and the bones take place. So, what happens? There will be a bend in the vertebral column we have discussed. So, now this bend will be reflected in the X-ray as the curling sign. It is the hyperflexion of the vertebral column. And then we have hollow sign. Hollow sign is the edema formation in the like skull. So, what happens? The brain matter is becoming collapsed. So, because of that it becomes hollow and swollen, and that sign is called as hollow sign. And then we have the still fetal sign. Still fetal sign is, you take an X-ray After 10 minutes you repeat the X-ray, and again after 10 minutes you repeat an X-ray. All your X-rays will be in the similar posture. The baby will not move in any occasion. The baby is going to have a still posture. It is because the baby is dead and it cannot take any other size or shape. Okay. So that is with your still fetal sign. And then crowding of the ribs. So as said earlier, there will be softening of the bones and ligaments. So what happens? Your rib cage is going to get compressed. It gets collapsed. So what happens? There will be crowding of the ribs. You can't see ribs like just like that. You can see ribs like this, no? But like once this IUD takes place, what happens? Collapsing takes place, and you will be able to see this ribs are overlapping and crowding. So that is called as like overlapping or crowding of the ribs. And then we have post office sign. Post office sign, we have discussed the gas bubble formation. No, that gas bubble formation will be shown as post office sign in the X-rays. Okay, so that is your gas bubble formation in your greater blood vessels and the abdominal cavity of the dead fetus, which is called as post office sign. And then you have ultrasonography. All these signs will be reflected in the ultrasonography also. And then we have Doppler. So you do an Doppler to find out the fetal heart rate. There will be no fetal heart rate. You can't see any cardiac activity for the fetus. Then we have blood fibrinogen levels. So blood fibrinogen levels you have to assess to see any coagulation disorders, because like once the fetus is dead, there will be a coagulation disorder. So like within 1 week, like you have to analyze the blood fibrinogen levels to see whether there is any coagulation disorders happening. And then we have blood investigation. So definitely you have to go in for ABO grouping and typing to assess RH incompatibility, and then you have to go in for an assessment of the WBC counts, and like you have to see the anemic level, that is like HB you have to rule with the mother, and like sometimes when there is any coagulation disorders, that also you have to rule out something which is related with the maternal cause. So that can also be found out during the haptological examinations. And then the complications. So complications of intrauterine death. So what is the complication? So maternal complications include, say the baby is dead before many days, there will be an infection. So when all these processes are taking place, by the time the mother comes to sensitize, she may become infected. So that will be a major complication. And the other thing is the coagulation disorders. She may go in for coagulation disorders. And then coming to the prevention aspect. How can you prevent? So prevention, actually all the diseases, prevention is very, very important. Okay, and now you have to remember the mother and the child. You have two areas where you have to consider. So always remember the factors which can put the mother under complication. So when the mother is having any comorbidities of diabetes, hypertension, heart diseases, anemia, and like she is having some bad habits as like tobacco and smoking, alcohol, all these things she has to quit. She has to quit all these alcohol and smoking. And if she is having comorbidities, she has to consume her medicines regularly. Diet, lifestyle modifications have to be followed thoroughly. Okay, so that is one way like where you can prevent this condition. The other ways are like a continuous antenatal visit. Okay, so there must be a regular antenatal visit for the mother. And in case of suspected cases, like where you suspect, where there is a previous history of IUD, in those cases you must have frequent observation, like where you have to go in for ultrasonographies, and like you have to teach the mother how to monitor the fetal movements. You have to teach, and like as soon as she is having a decrease in the fetal movement, she has to report in the hospital. Or you have to teach and you have to give adequate health education to the mother regarding the prevention aspect of IUD. And whenever you think of a previous history, a previous history of intrauterine death, you have to be little more careful and like precautious, and you have to educate the mother regarding the assessment of fetal well-being. Okay, so that is with that we finish the prevention aspect, and then we have the management part. So coming to the management part, we have the medical management and the surgical management. So medical management, the first thing is oxytocin. Okay, so already there is death of the fetus, so now you have to induce labor. Okay, so induction of labor has to be done. So induction, like we have already dealt induction of labor separately in the previous class. So if you have any doubts, you can go and visit your previous videos so that you will have an idea about induction. So you have your buccal administration, you have nasal administration, you have to administer oxytocin drops. Okay, so oxytocin usually like you start 5 international units in 500 ml, but now what you are going to do is like you are going to start 10 international units, and you have to same like you have to start with 15 drops, and every half an hourly you have to increase, and you have to add up 5 units of oxytocin every half an hourly. It is because like like it is like the fetus is dead, you will not have anything that is contributing from the body. Okay, so everything you have to do it artificially. So you have to administer oxytocin for the delivery of the dead fetus. Okay, so that is with oxytocin. That, and we have the Laudan's drip. What is this Laudan's drip? So this is the method of oxytocin administration in intrauterine death. Okay, method of administration of oxytocin in case of intrauterine fetal death, that is you have to start with 10 units of oxytocin in 500 ml of NS. Okay, and it has to go on like that. So you start with 15 to 20 drops you start, and you have to like increase the drops per minute. Okay, and every half an hourly you have to add up 5 units extra. So till 24 to 48 hours you have to keep on administering oxytocin. Okay, so with that only the fetus is going to get delivered. Okay, so that is called as Laudan's drip during intrauterine death administration. Then we have prostaglandin administration. Prostaglandin, already we have seen the oral administration and the intramuscular, intravenous, then you can give it as suppositories or otherwise like pessaries. Okay, so anything can be administered to cause ripening as well as to induce labor. So that is with your medical management. And surgical management, we have the artificial rupturing of membrane, where you are going to do an rupturing of the like membrane, that is like 4 waters you have to break. Amniotomy has to be done so that the fluid comes out, thereby labor is induced and you are going to deliver the baby. So this is what with your intrauterine fetal death, where we have discussed regarding the definition, causes, pathology, signs, symptoms, investigations, where you are going to rule out for these signs of Kernig sign, hollow sign, still fetal sign, crowding of the rib, post-office sign, ultrasonography, Doppler, and all these you are going to assess. And these are all very important questions for your viva. So where you will be asked regarding intrauterine fetal death, they will ask you the signs. Sometimes they will ask you the signs, and they will tell you to explain what is the sign and related to which condition. Okay, so then we have discussed regarding the complication, the management part, prevention part. Okay, so management part, you have medical management and your surgical management. Okay, so I hope you have understood this topic of intrauterine fetal death. In case if you have any doubts, kindly go and give your comments in the comment box. Okay, in case if you want any other topic, also give your comments in the comment box. Till then, take care. Bye.